Yeah, good morning everyone. I hope I am audible and visible. Just checking the things. Just give me a second to check things. Yeah, good morning, Dr. Shivangi, Dr. Jyoti, Dr. Priya, Piju, Shazia. Good morning, everyone. Nice to see these names again. Yeah, good morning, everyone. I hope I am audible and visible. I'll just reduce this size actually. Yeah, Dr. Naeem, good morning. I think audio video is good. It's little blurred, I think. Some network issue in office. All good. Chalo. That's great. Yeah, Dr. Anjali, good morning. Dr. Naeem, your audio video is good. Dr. Manak, Dr. Bhavika, back from vacation. Good morning. It's good to see all the rankers back again. But this session is for everybody, like not only from top rankers, but for everybody because yesterday I remember getting three calls. One was Dr. Shivangi. I remember two, I forgot to ask the names actually. And I told Dr. Shivangi later we'll have a good session on this. Okay, we'll have more sessions in the morning hours starting from today only regarding related to the counseling process. Not to worry, we'll help you with each and every step of counseling. Okay, so that's not an issue. Secondly, before that, let us discuss something which is being a total, you can say, mind boggling situation, which branch to choose, how to choose a college and all, right? Dr. Muskan, Dr. Namit is here, Dr. Naveen, Dr. Nirnay, good morning, Dr. Sohal Preet. Okay, so I'll start with a quote, like an old quote, like if you choose a job you love, you'll never have to work a day rest of your life. If you love your job, basically what you're doing, you will never have to worry about what things the life is going to challenges it will portray in due course of time. Okay, see, life is never going to be a smooth ride. We are just going to talk a little bit abstract here, philosophical thing, but it will change your mindset towards looking at things maybe from today onwards. Okay, but you all are grown up. I know you guys are smart enough cracking exams and all, so most of the things are already clear, but yes, this is one different aspect which we are going to discuss today. Okay, So I'll start with one question which most of you just type whatever comes to your mind. It's not about what you are going to take in the counseling. Okay. Which branch question has a lot of scope in dentistry? Just random thoughts. Okay. It can be the branch you think has scope, but you are not going to take it. We are going to start with this question because I am going to orient you in a different fashion coming to the answer on this, and I will not be able to answer this question for you. You will yourself, end of the session, you will answer this question yourself. Yeah, good morning, Dr. Ayushi, Dr. Soumya. Naeem says ortho. Chalo. One option we have is ortho, second is OS. Endo, prosto, PCD. Really good. Somebody mentioned PCD, PhD, pedo. This is the reason I started with this thought. I made a lot of notes to discuss today's session, listening about what people, the successful people, have been saying in last 1 year, listening about the experts in discussing with them about the various branches and all, and then I thought let me have a different aspect of it presented to you guys. OMR. Bacha kya? 1, 2, 3. Perio is left out. Okay, what is left out is perio, uh, OP 336 and 39. Yeah, Dr. Amrit is now on a different track. Okay, see, suppose let us start with a very simple thought. If suppose this is the pyramid of your dentistry, I'll draw it nicely. If this is the pyramid of your dentistry, Dr. Priya, I'll take the questions, just save it for the end. Okay, just save it for the end. If this is the pyramid of the dentistry, we have one inner pyramid also inside this. As per the Pareto principle is 80-20 rule. You all know 20% of the people are, like, on an average, this is all generalization, on an average 20% people end up reaching the top of the pyramid. 80% are struggling from here. Anywhere you can be, anywhere, like I can be anywhere in this pyramid, right? Dr. Akriti, I'll answer this question very precisely. Interest. Okay, let us start with something which you might be not aware of. If this is the pyramid of dentistry, only 20% are able to reach the top of the pyramid and enjoy a very successful life in their profession. Rest, many of us, 80%, maybe like 1%, say myself, if I take my example, I was in the base of the pyramid when I started. Slowly, slowly, we progressed. Okay, and we are maybe in 20% or maybe below it. It is all about perception, right? But yes, you have to find a way out to reach to this level because that is your ultimate goal. So if I ask you another question now, or you guys answer that these branches have got a lot of scope in dentistry, let me ask you question number 2. What do you actually want to become If I ask you this question today, what exactly or what actually you want to become? Answer. Chalo. Naeem had said ortho has a lot of scope, so he wants to become orthodontist. Good clinician. It is more broader term. Good clinician. Any other answer? Prosthodontist. Successful clinician. We have orthodontist, we have prosthodontist, we might have endodontist, pedodontist, and so on. Any other different answer than this? Best doctor in the field, oral surgeon. Okay. Now change the answer. Start saying it differently from today. Okay. You don't choose to, if you want to be in this top 20% of the pyramid, this 20% is comprising of those people who had actually never ever discussed about becoming, say, orthodontist, prosthodontist, surgeon, whatever it is. What they had discussed or targeted was these two words, or you can say a simple successful. That is the word you need to carry home today. Okay. And these 20% of the people are comprised of, they are a mixture of BDS, MDS, prosthodontists, orthodontists, oral surgeons, pedo, perio, OMR, anything to everything. So what does that mean actually? That branch actually doesn't matter. Okay. If I ask you one question, I ask you which branch has more scope, this is considered as a wrong question in today's time. Today's cats was always a wrong question. Question is, are you going to be the best in this particular branch? This is the right question. Are you the person who is ready for that branch? Then it is the right question. Branch always had scope. Dentistry always had scope. Oral surgeon, prostho, OMR, everybody, every field had a lot of scope since day one of their inception. It's about whether you are the right person in the right field for at the right time doing the right job or not. Okay, it was never about the branch, it was all about an individual per se, individual about you, individual like me, whether we are ready to cope up in that segment or not. People say dentistry does not have future. Okay, but yes, see, like I passed out 19 years back. Oh sorry, yeah, 19 years back. That time also we used to listen to the same word, like dentistry का कोई future नहीं है, dentistry over saturated है, डेंटिस्ट्री में बहुत लोग आ रहे हैं, बहुत बीडीएस पैदा हो रहे हैं, बहुत एमडीएस भी पैदा हो रहे हैं अब तो, लाइक वी हैव बीन लिसनिंग टू दिस वर्ड्स अर्लियर देन यू गाइस. But every year we see a lot of successful dentists. Every year we see people doing wonders, extraordinarily becoming successful, much bigger than what our imaginations can think of in the field of dentistry. And yes, we see people leaving dentistry, we see people going in different directions, frustrating out of it, frustration level in MDS, frustration level in BDS, frustration level in every branch exists. And yet there are people who are super successful in every branch as well. Okay, so first thing to understand this today's session is, remember this thing, it is about you who will make the branch or your job successful. It is not about the branch will not make you successful. You have to dig out success in any branch you feel like. So all those who are like in a situation where you feel your rank is not adequate, maybe say above 100 or 200 or 300 or 400, and you feel you're not going to get branch of your choice, there is no point like cribbing at this stage and cribbing at rest of your life. I'll explain you how and why. Okay, but if you are actually following the trends, if you are actually going with the world, what the world wants, you will be successful no matter you end up in any branch. People who are successful, see how we choose branch, how we get fascinated with any particular branch. How do we get fascinated with any branch? Number one is source, like I'm asking about the sources. Number one sources is like we see successful people in that branch. If you in your lifetime of your last 5 years, you are just in 20s, 5 or 6 years of your BDS experience, if you have come across some very successful people who are prosthodontists, you will feel prosto is good for you. If you have come across oral surgeons, you will feel oral surgeons are more successful. Okay, we see successful people and we get to get fascinated not with the people's journey, but we get to be fascinated with the branch. We feel अगर मैंने OS लिया तो मैं भी successful हो जाऊंगा या हो जाऊंगी इसकी तरह. Am I right or wrong? This is one source. Okay, second source is we hardly have any exposure. We hardly have any exposure of clinicals in our colleges. I don't want to name it, but yes, even some of the government colleges we don't get exposure. And private, many private colleges don't give you that much exposure. We are talking about at BDS level. We are not talking about at MDS level. Okay, so if you don't have any exposure, how can you be get fascinated with the branch? It's because we have done less of surgeries in BDS, we haven't done impaction, and suddenly we start getting love for OS. Okay, I give you one example. You all must have learned some sport in your life. Most of you, like if not all, most of you must have learned, played, excelled in some sport at school level first, local gully cricket level first, school level, maybe at zonal level. I was playing, representing my school at West Zone Delhi in table tennis when I was in 9th, 10th standard. I remember that. So I got fascinated with table tennis. Today, but I always used to like football, watching football. I had played football, okay, but I always like till date I don't miss out FIFA matches. I may miss out cricket. I don't care about a damn about cricket nowadays. Like, but in school days I used to love cricket. I have played cricket rest of my life, half of my life actually. Okay, but today I'll tell you, like for last 1 month, I am learning something new which has always fascinated me because I never knew. I am learning tennis. I started learning tennis last month because it always used to fascinate me. I have been watching tennis since the days of say Andre Agassi, Michael Chang, John McEnroe, like too old people for you guys. Like they didn't, maybe you were not born those days, like early 90s I'm talking about. Okay, but the sport used to fascinate me. I have never had a tennis racket. My parents' financials were not that great to put me into some tennis academy or something. Okay, racket. I remember going to buy a tennis racket with my mother when I was just passed out of 10th standard, and the cost was like so high for them that we came back. Even like I myself, I decided not to buy the racket and put a burden on my parents. Okay, this is how the things work. But yes, I have been watching tennis. I have been playing tennis on video games and all. So it always used to fascinate me. But that doesn't mean that I'll chase something which I have never ever had exposure of. Okay, it's just a fascination because it's something we haven't done. That's why it fascinates. It's like grass is always greener on the other side of the fence. What you order in a restaurant is inferior to what your person sitting on the next table has ordered. It is that feeling that मुझे वही order करना था. Oh, that is better. I was excelling in my table tennis, but I was craving for holding one at least once in my lifetime a tennis racket, lawn tennis racket. Okay, so this kind of feeling makes a prejudice towards a branch which we haven't done. Like ortho, if somebody says ortho, please don't take it personally. I always have been telling earlier also, I used to love ortho. I have left government non-clinical seat in my time for not getting orthodontist, actually not becoming an orthodontist. Okay, Dr. Naeem and others, please don't take it personally. Ortho is something which we have done only half exposure. Half means we haven't been allowed to touch these, what do you say, fixed cases and all. We have done only some of the removable cases, that too very low level cases, but still it fascinates. It's not wrong, you are not wrong. I was also fascinated, and maybe if I would have done ortho, I would have done wonders in ortho, maybe. Okay, but try understand the ideology, how we have prejudice towards some branches, maybe prosto, maybe ortho, maybe OS. Number one is we see successful people, we see related to the clinicals exposure we get in college, and basically the exposure which we don't get. Most of the colleges don't allow you to do higher surgeries and all. Impactions are also not allowed most of the colleges. So surgery gives you a good sense of, you can say, gratification. Like if I become a surgeon, I'll be god. Like that's what surgeons are all about. Okay, so this is the basic part. Okay, how we get to come into that spectrum of identifying branches for us. Third is we started hating few branches by seeing unsuccessful people. Like in my time, I had seen a 2-year old pedodontist in my life who used to practice near my house. He wasn't successful, his clinic was not running. So I used to have a prejudice towards that branch कि सारे pedodontist बेकार होते हैं, इनको कुछ नहीं आता है, just because my sample size was one pedodontist near my house. Okay, his clinic was not working up to the expectation of his family and his own level, and others also were perceiving the same thing in the surroundings. Okay, so these are the basic sources how we classify the branch, whether the branch is going to be very scopeful in the near future or not for us. But question still remains, what is the scope? What is the scope of any particular branch? For this, actually the question is, what's the scope of dentistry in future in India or maybe abroad? Okay, what's the scope of dentistry? Does dentistry needs more of BDS or MDS? Answer is no. BDS and MDS are just the degrees. We don't need more of degree holders. But what we need, the world needs, the surround environment needs, the country needs, and the entire globe needs is skilled professionals. We need experts in every field. We need people who can transform the future. We need people who can innovate. Basically, in simple language, we need people who can think out of the box. Whether you are a prosthodontist, ortho, you end up doing anything, if you don't have this approach, you will get stagnated. You are born in the era of, say, you are ready to be into the world of dentistry in 2023. If somebody in 2023 decides today to not upgrade the education, say by not doing MDS or by not upgrading their skills, and tries to continue opening a clinic and doing only RCT, scaling, fillings, okay, which is like 20-year-old treatment now, 20 plus actually. I joined college in 1999 and RCT was a well established term that time. Okay, well, at least in 1991 RCT might have started very well in India. So if somebody today decides to strive in their practice, in their profession based on the treatments which are 20-year old or maybe more, how can you be thinking of growing into the pyramid with this minimalistic approach? You will become what? Nokia of mobile phone industry. You know how Nokia got outdated? Nokia was the leading cell phone company across the globe. Most of you don't know from Nokia where it comes from. What is the country origin of Nokia? Nokia was just coming as a small device which became the household name. In every house used to have one Nokia phone across the globe. Then came what was touch technology, which was brought up by Samsung and then later on adopted by many people. Samsung was, when Nokia was leader, Samsung was number 2, number 3, number 4, or maybe nowhere in the market. But when Samsung came with the touch technology, Nokia decided to remain like this. I will not enter into touch screen format. I will remain old school. I will do only RCT and scaling. I will not learn implants. I will not learn full mouth rehabilitation. I will not learn digital dentistry. I will not learn CT scan and all. But I will continue doing this. What happened in next 5 years is everybody knows Nokia is thrown out of the market. Now nobody buys Nokia. If any one of you has Nokia, God bless you. The phones are not bad, but technology is very primitive now. Okay, technology is very primitive, right? So to grow in that pyramid, again I'm going to give you reference again and again of this. You have to become what? Problem solvers. This is what the term in today's scenario, today's world. If you are not solving any problem, if many of you have seen Shark Tank or something, this is a very common phrase they are using nowadays. The world needs only problem solvers. Remember, market never gets saturated with products. You see washing powder, you see 100 companies in washing powder. You see cold drinks, see 10, 20 companies in cold drinks. You see dental coaching institute, you see 10, 20 dental coaching institutes. Likewise, you can see any number of any industry, any market for any product or services, you will see ample. Smartphone, you have at least 100 companies making smartphones. Market never gets saturated with products, but market always gets saturated with bad products. So if you are a great product just to indicate an individual here, okay, don't consider yourself as a non-living thing. If you are a great product means if your education is good, if your skills are good and you are ready to take up challenges, then you are ready for any industry. Okay, then you are ready for any and every industry. If you are a great product, it doesn't matter which branch you are from, you will be successful. You will be successful if you have that characteristic to grow. You will be successful. So if we try to identify the traits of a great product, or you can say great BDS or MDS doctor, number one is you should have hunger for success. You should have hunger for success. You should not sit down, relax of achieving small goals, and then it is basically, yeah, good morning, Dr. Pallavi. Seriously long, Dr. Pallav Sharda. Sorry. And if you don't have hunger for success, then you will end up blaming your branch, you end up blaming your field, end up blaming dentistry and this world for your failure. Number two, You should have capacity to fight back every time, every given time. And Dr. Nefla, I'll answer these questions, not to worry. Okay. Capacity to fight back. You cannot accept small failures. You cannot accept small failures. Okay. I'll give you my example. I was very happy running my clinic in 2006, starting my clinic actually. My batchmate from BDS, he was running for 1 year academy called as Target Educare in India in MDS coaching. He approached me in 2006. I refused him. Okay, in say around April or May, he came. He came to my house and discussed a lot. I was not interested. November 2006 AIMS, like that time AIMS used to be happening only in Delhi. He came again and he was sitting in my house discussing and all. This time I showed little interest because I had started my clinic and I knew my clinic is not giving me a lot of output. Plus, I was idle most of the time sitting in my clinic. So I decided let's explore this. Okay, let's explore this MDS side, though I was never interested that time. I explored, we started working 2007, we did a major batch in Delhi. Okay, test and this that time used to be only test and discussion, no live classes, nothing. Morning mein test followed by a discussion. Dr. Varun Pruthi, Dr. Varun Pruthi's wife Preeti, many of the batch of that time of Maulana Azad, almost everybody was our student. 2008 result came very good. Okay, we were doing hard work, students were doing more hard work definitely, and they got ranks. We got 37 out of top 100 ranks in India. Okay, there were hardly 120 seats those that time, 120, 130. 2009 we got India's biggest result, and then there was no looking back. We got rank 1 also. We got 87 out of 126 or 123. 87 ranks out of 126. Imagine, two-thirds of the market, like almost 70% of the market share, right? Then there was no looking back. We touched peak 2016. My friend one day decided to just shut it down. Okay, and then I came the offer from Bhatia. I was at zero. Okay, when I joined Bhatia, they very well knew it. They offered me, and like in partnership and all. Not only me, it is not only me who is working in the institute, it's all teamwork. But in those 10 years, 2006 to 16, I was struggling making team. Many people like MDS people used to come, teach, fall back, leave. New people we were trying, and then we came like around 2011 or 12, the team became stable, pretty stable, apart from one or two here and there. But most of the subjects, the team became stable. 16, we started with Bhatia. October 1st, October 2016, I joined DBMCI. The entire team joined, not only I, like myself, and even one of my old staff also joined with me, and we started working in a direction like जो काम आता था जैसे आता था we were doing. Okay, because we believed 10 साल MDS में काम किया है तो let us explore it to some extent more before deciding to quit it. Okay, before, just because the brand died, when Target ended up, then only the other institutes started rising. But you cannot stop the competition. Okay, you have to fight back in a fashion that you are making deciding the competition in the market. You're not following the trends. You have to be a trend maker in longer run. I'll ask you one, if anybody has known little bit of this. 2017, when we ended up with this what do you say, NEET, 2017 NEET, how many rankers we got in DBMCI? Answer is zero. Zero out of first 500. I'm just talking about first 500 as of now. उसके आगे का मुझे याद भी नहीं है. There were rankers, but yes, one student I still remember was 800 something. She was from Odisha, and because of state counseling, she got a government rank. We got to know 6 months late. Okay, because we thought less than 500 will not get a rank, not get a seat, government seat. but through state quota you can get up to anything. That we will discuss in the counseling sessions as well. Okay, so you need to fight back. We fought back in DBMCI. We make it to one of the biggest institute in India, and this year we are again zero. We again started with zero, but with a zeal to fight back, with the capacity, intention to fight back. Okay, so no need to be like afraid of the hurdles you will get in your MDS. You will be failing a lot in your MDS curriculum also, in your cases also. Post MDS also might be there are some situations where you will feel depressed. But if you can fight back, you will become rich and famous and successful. It's not about becoming prosthodontist or oral surgeon. It's about becoming rich, famous, and successful. Okay. Third is you should be having originality. Okay, originality and innovative mind. If your mindset is like this, then you will excel in that pyramid. You should have willingness to learn. This is one advice you should keep rest of your life. Whenever you are attending any seminar, any conference in your MDS, during your MDS or anything, make sure you go empty vessel type situation. You are empty handed, you are totally blank. Listen to what the other person is saying, then only you'll start perceiving something, receiving and perceiving something. Okay, don't try to show off. Maybe you know everything, maybe you know more than the speaker on the day of that conference, but still if you listen to that speaker experience to some extent, you will get at least one important tip for that day, and that might be your game changer in your life. Okay, you have to have willingness to learn, keep on learning things to grow. Next is you need to have adaptability to different situation. Simplest example is don't become Nokia. You have to change with the changing trends. Next important is develop communication skills. This is traits of a great product. Okay, we have discussed this. Trait to become rich, famous, successful. Rich, famous, and successful. Traits not to become a prosthodontist or orthodontist. No matter what you become, learn communication skills, learn speaking skills. There are online courses also available nowadays, Udemy and all. How to, like I'll tell you, when I was doing my MBA, regular MBA, first thing, like my class teacher over there, like they used to have a class teacher for every semester. Okay, she was teaching. There is a subject in the first semester called communication skills. Okay, they tell you how to dress up, they tell you how to shake hand. That is the first time. Like she was a lady and she was very good looking actually and she invited each and every guy, like we were all students, and she invited each and every student, girl, boy, coming to her table and shake hand with her. And you know, being a you can say there is a different in like inborn hesitation or something, shaking hand with a girl, that to an unknown, and that to your teacher. Like my hand was like just touching her like this. That's what we always do if somebody brings out your hand, but that is what she scolded. And she told like you cannot shake hand like this, there is a proper technique of holding hand, shaking it, and then leaving it. So these are things which will change, which will give you something like make you more confident in life and develop as a great product in life. Okay, then is ability to network. These things will help you during your MDS also. Start adopting these things. Okay, you should have a great network. Great networking sites are not Facebook. Facebook to some extent is there, it's not Instagram definitely, but yes, nowadays it's Instagram, so you should be follow it. You should have great presence on Facebook, you should have greater presence on LinkedIn as per today's trend. You should have even on the latest thing called threads. Okay, have an account on threads, start posting today. You know what is said in internet world, if you have made account today, it means you are born on the internet today. And there are people who are maybe 10-20 years older than you, and the internet, and they make huge difference. There are people who do less work but they talk more and they become successful. But yes, people like you maybe who work more and talk less may end up having that you can say side effects of today's technology and social networking. So ability to network not only on social media but yes in physicality also, attend conferences, meet people, carry a business card or whatever, or just maybe your profile name or something to get acquainted to. Okay, these will help you in longer run in becoming more successful. Then eighth is accept new trends and technology. We will discuss this in a branch. Okay, identify and learn from own problems. That is last, the same thing again. You should have a problem solving approach. You should have a problem solving approach. Okay, so where people go wrong in making choices for branch. Suppose I saw somebody, some orthodontist who is very successful. My ortho knowledge from college is only half or maybe less than half. But ortho fascinated me to an extent. Ortho fascinated that I always wanted to become orthodontist. Okay. What happens is suppose I end up taking ortho जिसके बारे में मुझे कुछ पता ही नहीं है, क्या कराते हैं उसमें, क्या होता है, हार्डली आई नो. I've just seen some PGs working and so on. I'm just giving you an example. I knew a lot of things about ortho. Okay. But this is just an example. I ended up taking ortho and then I realized it's not my cup of tea. I started hating ortho. I started hating it. I started finding ways how to come out of this trap of being an orthodontist. So I ended up learning RCTs and rest of my life I am just doing mediocre general practice. This is the fate of more than 50% MDS pass outs every year. Have you ever come across such people in life? No need to name, yes or no. I have seen, if you ask me personally, I have seen such cases in ortho, prosto, pedo, perio, endo, OS a lot, many. Others maybe I don't know. Dr. Mukti Sonam, I am not MDS in any branch. I have been telling, and that's what people are making fun of me every day. Other institutes, especially, that the person, the people here in BDS to MDS are like, there are some people who are not MDS. That's what they, yes, that's the reality. I don't blame them. They are just telling the truth. And God bless them for telling the truth. But this truth is not hidden. You ask me this 100 times, the answer is same. I will not boast. I have done BDS, I was All India Ranker 135. I was getting oral path in government, pedo in CMC Ludhiana, many branches except ortho in Maharashtra. But I didn't take. And financial conditions, family condition didn't allow another attempt. So I chose up ending up setting up practice. Then after 10 years, I decided to do MBA. I have a practice. I do a lot of implants. I have done great work, next to great, not great, next to very close to greatness in cosmetics, cosmetic dentistry, aesthetic dentistry. Okay. Any other thing? If you feel bad about learning from us, then I'm really sorry you didn't know this fact earlier. Okay. But we are not ashamed of the reality because we knew how to get into the learning curve, how to excel, how to become rich, famous, and successful. Right? So, the problem here is don't end up. Don't end up taking decisions like this. Don't end up taking decisions like this. No matter what branch you take, you have to keep on exploring that branch. Keep on exploring in that branch. Okay, you do MDS, you enter into MDS. MDS is of your 3 years. Okay, MDS, you all know, is of 3 years. So what you are supposed to do in these 3 years is, number one, explore the branch. Do as many things as possible, read as much as possible to understand the things people have been doing in the past in the field. Okay. Second thing you're supposed to do is experiment. The more you learn, the more you start experimenting. Remember, college will give you ample time to experiment. Your life won't give you ample time to experiment once you pass out in these 3 years. And with both of these, you basically learn in these 3 years. Once you pass out of MDS, you have to devote at least 7 years of life in that field, gaining more and more experience every day. With more and more experience, you will gain expertise. That is 10 years from today, you can call yourself as an expert in the field. That is the time when you can enter into educate others about your field. You can enter into research related to your field. You can actually enter into innovation. You can innovate. I can give you hundreds of examples. I'll give you few who have really done innovation, and that is where you start becoming more and more successful. Okay, that is the secret recipe of becoming successful with MDS. People ignore this part. Explore, experiment, and learn. Explore and experiment has an integral part that is called failure. Okay, so if you when you take up any field, when you take up any field, you face a lot of failure, and that is where you learn and then grow in life. There is a definition given by very big researchers like Henry Ford and others. Success is defined. Success is defined in terms of how early you started failing. How early you started failing. The earlier you fail, the earlier you learn, the more experience you get in life to excel. Yeah, Dr. Shazia, thank you. Dr. Naeem, Dr. Shivangi. Okay, but ठीक है ना, we don't mind. It's just a part. every year people I know abhi this saal from our previous institute we are listening these words and but उससे पहले हर इंस्टीट्यूट वाला एक बार तो हमें गाली दे चुका है. When I was in target educare, then there was an institute called ahead. They used to abuse me. Then people from southern India, they started abusing on Orkut, then Facebook. I have those screenshots with me and I really laugh at them whenever I see come across today. I still have in my mailbox those screenshots कि BDS है, बेवकूफ बना रहा है दुनिया को, हैं खुद ने कभी MDS नहीं करी. अरे कोई बात नहीं ना, आपने करी है आप पढ़ा लो, मना थोड़ी किया किसी ने. ठीक है. It's about your learning curve, how the curve goes by, right? So with this part of abstract teaching you related to becoming rich, famous and successful, okay, then comes the decision of taking into specialties. Number one, prosto. I'll give you insight of these, we'll have more session on these, not to worry. Based on all this, start thinking on the lines and start coming to some conclusion. Again, if you are having like difficulty, you can always call me, WhatsApp me. Call, WhatsApp. If I'm not able to pick up your call, just drop me a message, I'll call you back. 9350256286. 2005 से यही नंबर है मेरा. The day I came from Mumbai, okay. The number is same 93. You can call WhatsApp if you have further queries related to this topic, counseling and other things. But one step at a time. Almost every day we'll have one session in the morning related to your counseling, MDS selection and other things. Okay, starting today only. Prosto. Prosto is oldest branch in dentistry. Why oldest branch? People had always you can say uh, craved for having substitution of lost teeth, and trust me, it is the branch which will remain forever. It will remain forever. Okay, I'll take the question, Dr. Surya. Apply in 2 states. Okay, just fill up the counseling and you can attend 2 counselings. Prosto will remain forever. That is why we say prosto is evergreen branch, कभी ना खत्म होने वाली branch. Prosto has a lot of money involved, good payout, and with implants coming as a boom, you can not imagine to what level prosto care people can grow. Now the topic here is not what prosthodontist can like is doing today, but what is the future. Okay, like we said, if you are good in prosto, you can think on the lines of doing full mouth rehabilitations. You can come up with 3D printing technologies. Okay, you can come up with something more innovative. People hadn't thought of implants till last 20-25 years, but yes, those who thought of it, they changed the dimension of the dentistry. When I was in college, implant was just a term we heard, I think in second year or third year, 2001 or 2002. And tab ek suspense tha, what is implant and all. Maybe our teachers, Dr. Ali Tunkiwala was there, Dr. Mohit sir was there. Dr. Ali is a god, okay, in full mouth rehabilitations and other things like implants and all in India. There are two people who are really great in prosto in India. One is Dr. Ali in Mara, Bombay, and Dr. Dhruv Arora in Delhi. Okay, no, I am talking about people who have passion for the stream, and that is how they excelled. Chalo, I'll tell you based on the things we have discussed today. Dr. Dhruv came to me in 2012. Okay, he passed out from Jipmer BDS from not a very great college, but yes, first batch of Seema Dental College, which most of you might not have heard of, or North Indians might have heard of. Okay, 2012 he came. I asked him what you are good at. He said dentures. I am very good at dentures. My thesis was on implant, but most of the implant were not successful. The same thing he will tell everybody in every podium. Okay, he used to come to my clinic to do dentures. He used to go to any and every clinic just for say मार्जिन ऑफ 100 रुपीज 200 रुपीज। कई क्लिनिक पे तो डॉक्टर ध्रुव ने क्राउन कटिंग करी है फॉर एक्सचेंज ऑफ वन बियर बॉटल which was around 60 70 80 bucks 2012. Imagine dedication to work, the hunger to grow. Find the start identifying the traits of successful people. Okay, this is what these are the traits. Hunger for success, that I want to work. Capacity to fight back, he was losing track. Okay, by doing so many consultations he was not able to focus, but again he was springing back. Willingness to learn, he was like, we did one BPS denture together, and he told me very bluntly, like, this is my first denture, BPS denture I'll make with in your clinic. And you know, the hard work he had committed. रात को शाम को पेशेंट होता था अराउंड 8 और 9, द पेशेंट का प्रोसीजर से फाइनल इंप्रेशन, सपोज जॉ रिलेशन कंप्लीट किया, ही यूज टू टेक इट टू अ लैब इन लाजपत नगर, रात को लैब वाले के पास जाके 2 घंटे खुद आर्टिकुलेटिंग आर्टिकुलेटर पे माउंट करके अपने सामने सब कुछ सेटल करके, देन ही यूज टू गो बैक होम एंड स्लीप। एंड देन डेंचर बनना है लैब में, रात को वहीं खड़ा रहेगा, अपने सामने फिनिशिंग पॉलिशिंग कराएगा, बिकॉज दैट वाज हिज फर्स्ट BPS डेंचर। दैट इज हाउ द डिफरेंस इज मेड इन लाइफ। एंड टुडे, that time he told me, I always want to do implants, I am pursuing, he was failing, he was not able to get acknowledged in implant, but today is the time when he does only implant. Today means for last 5-7 years से मैंने कुछ और करते हुए नहीं देखा डॉक्टर ध्रुव को। टुडे you call him up कि डॉक्टर ध्रुव come to my clinic for a denture, he will say no, I don't go for dentures. He doesn't go to one, he just goes to 1 or 2 clinics, but that too only for full mouth implants, not even for a single implant, because he doesn't need to now struggle in that zone. It's been 10 plus years and he has made his mark in the specialty he wants to grow. But yes, he gave time to it. Okay, so prosto has lot of scope. Prosto will always have scope, but prosto के लिए ना prerequisite I always tell student is, you should have a good handwork. All those people who have good handwork, good skills, like carving skills and all that, prosto आपने किया है, you should take up prosto, artistic hand. Okay, basically if you have artistic hand, you should not think of any other field, you should think of only prosto. You should think of only prosto and you will excel. But if you say I hate prosto and all that, then I am not the person to comment on that. Okay, I gave you a very brief idea about, no matter what branch you end up, you have to be great in that branch to excel. The branch will not excel make you excel, you have to excel in that branch. Okay, you have to do great work in that specialty. Second is, you need to be ready for failures. Many a times you will face failures in prosto, okay, more than any other branch. So if you are a person who gets disappointed very fast, you should not end up taking prosto. Okay, so any questions? We'll go one by one. But yes, prosto is something which will give you good name, fame, fast money, easy consultations and all that. But again, it's not about getting job, it's not about getting settled, it's about becoming rich, famous and successful. Don't think, narrow down your research of branch versus yourself on the conversation of what you do in that branch. Hardly matters. आप उस ब्रांच में क्या करने वाले हो, क्या नहीं करने वाले हो, कोई फर्क नहीं पड़ता। आप उस ब्रांच के लिए रेडी हो या नहीं हो, दैट इज मोर इंपॉर्टेंट एंड दैट इज मोर अकाउंटेबल। आप उस ब्रांच में कुछ इनोवेशन करते हो नहीं करते, कुछ उसको नेक्स्ट लेवल पे ले जाते हो नहीं ले जाते, दैट इज वेरी वेरी इंपॉर्टेंट। ओके, सो फर्स्ट, एनी क्वेश्चंस रिलेटेड टू प्रोस्तो, just ask me. Next we start with endo. Cons endo, actually nobody mentions cons. That is one basic deficiency, and that is the place which gives you a scope of growth in life. If I tell you, इंडिया के बेस्ट कॉस्मेटिक डेंटिस्ट, इंडिया के बेस्ट कॉस्मेटिक और एस्थेटिक डेंटिस्ट, दे आर नॉट कॉन्स एंडो, MDS. What is your reaction on this? The man who brought the word aesthetics in India, Dr. Sandesh Maikar, is an oral pathologist by degree. Okay, Dr. Suhas Lele, supposedly he is just a BDS. Dr. Sunil Bhulavai is again just a BDS, but he explored more in the world through DDS. Okay, endocons is something, it's a feel safe branch. It's a branch which will give you good initial start to your practice. If you want to settle down fast, open up a clinic, or immediately you want some work and you are not ready for more of exploration, you don't want to take a risk, endo is a good option. Okay, for endo, one thing which is very much prerequisite is patience, though patience is required in every branch, but endo is like you have to work in a very small zone called apical, sorry, the orifice of the root canal, that small orifice which hardly where 10 number 15 number file can enter. You have to have a lot of patience to go to the apex of it and come back without breaking the instrument. Okay, the more of hand versus brain versus skill versus eyes coordination is required in endo. Endo is a branch which will, like, all those who are very much, you can say, having delicate hands, all those who have like work in small precision atmosphere should think of going into endo. Dr. Alia will discuss these in another session tomorrow related to how to choose a college. But let us now end up this, like, fix up this in relation to the branches. Okay, I'm not saying endo is bad or prosto is bad, I'm just giving you an insight that these are the things you are going to be facing in endodontics. Endo, it is a lot of demand in terms of what you say, consultants. There's a lot of demand in the corporate world. There is a lot of innovation coming towards microscopic endo. There is a lot of innovation coming towards biomaterials and whatnot. New update in endo is, that's what I finished up, Dr. Nikhil. Then is ignored part, cons. I haven't come across a single endodontist who calls himself as a conservative dentist as well. In last 20 years of my existence in dental field, that is the problem. And that is where I feel a void. If you are a cons endo person, see, you will end up doing a lot of endo root canals in this. You ask Dr. Varun, every cons endo PG is 90% endodontist by heart, 10% conservative dentist by heart. And that is where the scope of your rises. You enter this part of, you excel in conservative, you go into aesthetics, you can do wonders in life. There is no limit in cosmetic world. Okay, there is no limit. See, one thing, when we were talking about this pyramid, this 20% of the pyramid, I'll just make it again. If we talk about the 20% of successful people and the base of the pyramid, that is 80-20, this 80% is majorly following the clinical route to go upwards. Like you did MDS in endo, you do a lot of root canals, you gain a lot of experience, you become expert, and thereby slowly and slowly you want to rise in your field as an expert endodontist who is now earning more and entering into this top of the pyramid. But if you actually see, this pyramid is comprising of the people who are not just clinicians, they are into academics, they are into research, they are into innovation, they are into business, they are into technology, they are into any and everything which is different from clinical but related to the field. That is where the thinking out of the box comes into picture. So if you want to be very much fast and aggressive in your approach towards the growth of your life curve, rising up in the pyramid, you have to think beyond these subjects, beyond these specialties. Cons endo does not mean you will do rest of your life RCT. You have to think on the lines, how can you like put your brain, heart and soul into the field and think of something which nobody has ever come across. I'm giving you one insight. Nobody in the cosmetic field is actually into cosmetic, especially like I can think of only one or two names. Dr. Prashant Hatkar, he is an endodontist and he is an American Academy of Cosmetic Dentist accredited member. Only one name I can, I think of. There is another Dr. Mohan Bhuvneshwaran in Tamil Nadu. Mohan Bhuvneshwaran. He's a legend, American accreditation dentist, but I think he's BDS. He's not MDS. Okay. So there is a void in conservative. People are doing a lot of endo. So if you end up doing endocons, start devoting time to conservative also, rather than just becoming another endodontist. The country does not need MDS endodontics. Okay, the country needs person who can solve problem in the branch of endo and cons. So you can be a problem solver in conservative more, rather than just becoming another endodontist in the crowd. Don't just remain the same person in the crowd. Okay, if everybody is doing the same thing, you also do the same thing, you will end up rather creating more competition for yourself rather than coming out of that competition. Okay, like to endo, there is a third specialty, pedo. Pedo is, we hear the words like it's a lot of emerging in pedo. People are a lot of growing in pedo. One fact which is very strange is every year there is the lowest amount of, amongst all the clinical branches, lowest number of pedodontists pass out in India. Amongst all the clinical branches, the least number of seats in India is of pedo. So there is a lot of scope of pedo. Pedo is much of ignored, but all those who are doing a lot of work in pedo are becoming very successful. Okay, our faculty, Dr. Vivek Gaurav sir, you visit his clinic in Dehradun and you will be shocked. 5 to 6 chair clinic, big clinic, and maximum of his OPD are children only. You know why pedodontists can be very successful? They are very successful if you are able to treat children nicely. The entire family becomes your patients, and it's more of clinical work you will end up doing in your clinic. Okay, so pedo does not mean only handling child. एक another misnotion is pedo is a branch for girls. Pedo is not branch for girls. Yes, girls are more, you can say, happy and smart, or maybe more an asset when it comes to managing children. Boys like myself, I am afraid of handling others kids. Okay, including my own child also. Chalo, I am afraid of my daughter at times. But yes, girls are not, for motherly instinct and all, but which we cannot have. But more successful periodontists in India are boys, males. Okay, the people who are doing great in their practice are men only. So it's not a gender biased branch. It's very, like, you see HODs, you see top notch periodontists, you just search them, you'll see it's like a great. Pedo is emerging because every other branch is emerging, every other branch is emerging, so pedo is also emerging. Pedo is a, you can do wonders in endodontics. In pedo you can do conservative, you can do cosmetic, except higher surgical part, you can enter into every stream related to pedodontics. Okay, so pedo is a good career option because it involves a lot of things to be explored upon. Perio. Okay, how many of you like or dislike perio? Can you just comment on this? Do you like or dislike perio? like perio. What do you like about perio? See, we are living in India. Then there is another country called US. You know, the major difference in dentistry in the two countries is US follows specialty license concept. Specialty license. India does not follow it. Specialty license means if you want to practice exclusive pedo, perio, ortho, you need to get that license and then only you will be doing it. Okay, ortho will be treated only by orthodontist, not by anybody else. Perio will be treated higher perio procedures. Yes, Dr. Fatima, that's what. We don't know what is in perio. Most of us have end up doing only scaling in perio. Okay. Specialty license concept is in ortho. That is where the problem lies in US. Like if you have done perio or ortho in US, rest of the life you have to practice that only. India does not follow this code. So endo, perio, pedo, prosto, public health, OPATH, to some extent OMR, all these are very much overlapping with each other. इंडिया में पेरियो वाला भी आरसीटी कर रहा है, एंडो वाला भी गम सर्जरीज कर रहा है, पीडो वाला भी इम्प्लांट कर रहा है. इम्प्लांट की एज इज अबव 16, अबव 18. Okay, but pedo ke end line is 14, but still pedodontists are doing implants because we don't follow this strict code of specialty license. So this is actually an advantage in India. Okay, perio is something which is like least understood and misinterpreted in India. We think after passing out we'll do only gum surgeries. Why you will do only gum surgeries? Well, are you practicing in US or you are practicing in India? First decide that. If you want to practice in US, then do perio in US to practice only perio or any branch per se. Okay. So if you are like periodontist and after 3 years you want to treat endoperio lesions, you will not invite somebody for endo. You may invite, but you can always learn endo and do treat cases something on your own. You end up doing implants in perio, so you can end up learning implant prosthetics as well and grow as an implant practitioner. You do higher bone surgeries, bone graftings and all. The future of dentistry was implants 10 years back. Today, implants is a settled treatment option. So future of implantology is grafting and aesthetics. That is where the role of periodontist nowadays has increased because of more demand in grafting, more demand in aesthetics. And aesthetics means not only teeth, aesthetics means gum aesthetics as well. Okay, again the same thing, have more, you can say, if you end up taking perio, or you, I would say in a different format, अगर आपको पेरियो मिल जाती है और पेरियो ही लेनी पड़ती है, don't be sad. Explore the branch, explore the avenues like implant, grafting and other things associated with it, and you will do wonders in life. See, 5 साल 10 साल बाद ना आपसे कोई नहीं पूछने वाला you are MDS in which specialty. If you are successful, rich and famous, like today somebody asked me which branch of MDS you are specialized in. Okay, after so many years I did my MDS entrance in 2006. So अगर मुझे MDS करनी होती और उस टाइम मैंने ली होती तो 2009 में मैं पास आउट हो जाता. 14 years के बाद कोई मेरे से पूछ रहा है, hardly matters to me. Okay, it's your work which will speak more than your degrees. So don't just end up getting a degree and getting no expertise in the profession. Okay. Yeah, Dr. Akriti, options हर फील्ड में है. Try understand. Because India में you have to have an overlap in the field to grow. If you want to be in this top pyramid base, you have to have multiple options coming through. Why multiple? You have to explore multiple avenues. Suppose you end up doing perio. In 3 years of perio, what you will done, you will explore, you will experiment, you will learn. and then you realize you are very good in implants. अब आपकी MDS खत्म हो गई after 3 years. You know everything about implant surgery. You know everything related to the perio aspect of implant, but you lack in prosto aspect of implant. Okay, suppose you lack in prosto aspect of implant. Then what if you want to come into this top pyramid? Your duty is to not make this as your deficiency. Do a short course. किसी ने मना थोड़ी किया आपको MDS के बाद भी पढ़ाई करने से. ओके, MDS के बाद ग्रो करने से. इफ यू डोंट ग्रो यू विल रिमेन लाइक अ ट्री, सेम एवरी ईयर. Okay, so keep on growing, keep on moving in life, keep on rising above that mental block कि मेरा सब कुछ खत्म हो गया, डिग्री हो गई, that is end of my education. It's the worst thing you can do to yourself. Okay, learn prosto skill as well and do the prosto part of your implants yourself. Rise in that. Okay, keep on growing in that, keep on increasing your learning curve, and that is where you will keep on going up to top of that pyramid. What I was trying to tell you is why you need to explore multiple avenues is the more avenues you try, the earlier you fail and the earlier you rise from that failure. If you try only one avenue, that is perio किया है तो अब सिर्फ gum surgeries करनी है, that may become a disaster after 2 3 5 years. If you have 10 20 things ready for you, ये नहीं हुआ तो ये नहीं मिला तो वो, I'll do this, I'll do that, with my degree, with my education, with my experience, and you try 10 different modalities, एक ना एक तो आपको ऊपर लेके जाएगा, ग्रो करेगा, एक्सपोनेंशियली राइज करेगा. ओके, फिफ्थ, oral surgery, least understood branch amongst BDS, क्योंकि काम तो किया ही नहीं है. ओके, बट मोस्ट fascinated branch, most fascinated, because again देखा तो पता ही नहीं है ना करना क्या है, तो इसलिए fascination है. What important is, I always say, is there is a thin line, there is a thin line between whether you can be a surgeon or you cannot be, or you can say you should be a surgeon or you should not be a surgeon. If I ask you whether you want to become an oral surgeon, if you are having doubts, it means you are not ready to become an oral surgeon. Don't take oral surgery. I have seen maximum misfits in my life in this field. Misfits. 3 साल बाद समझ ही नहीं आता करना क्या है. And don't treat yourself as a specialist of just extracting teeth. Oral surgery is way beyond that. Nowadays, oral surgery has opened up more avenues because of implant. Grafting, पेरियो वाले के लिए सीखने में टाइम लगता है, OS वाले के लिए जल्दी होता है. Okay, chin grafting, onlay grafting, block grafting, many things are zygoma implants, sinus lift surgeries. Oral surgeon के लिए मजाक होता है जल्दी, because they are a habit of cutting, and okay, we are not into habit. Okay, I do a lot of implants, but for higher surgeries I invite my oral surgery friend from Jaipur. I invite him from Jaipur. He's my batchmate. I trust him. I invite him. He does sinus lift and I'll put the implant. मैं नहीं लेता पंगे. Okay, I do safe practice. Why should I be bothered about the something which I have not mastered? Okay, जब जिस दिन मैंने मुझे लगेगा I'll learn that skill. I have learned sinus lift. I have done one or two, but I realized this is not my going to be my forte in near future, so I didn't practice it more. So it is like this only. I'm happy. Why should I be more taking more headache? See, you can't do anything and everything yourself. Okay, somewhere you have to draw a line that this is beyond your expertise. So let us stick to the expertise level. I have done a lot of implants and gain expertise in placing implants. Okay, at right angle, right height, right depth, right dimension. everything is, I know the placement related to implant, but I have been not doing sinus surgeries, so that is my limitation. So that is, and just giving you an example, that is where the problem starts with people. They don't know their boundaries. Okay, if you think you are a person who can stand blood, who can stand for hours, and who has liking for cutting down human flesh, okay, it gives you happiness seeing more blood, seeing cutting, giving, doing surgeries for 4, 5, 6, 10 hours, 20 hours, then yes, you are the person who is rightly made for surgery. I don't want to name. In the past, every year, like not every year, at least 3 cases in last 7 years, students have taken government oral surgery seat, and left the college because after 1 or 2 months, 3 months, they realize they are not right candidate for this branch. Okay, okay, that is something. Doctor, next I didn't understand. Do you do any implant means what? Any implant means what? Exactly. Okay. Otherwise, oral surgery is like any other branch. Oral surgery is also in demand because a lot of implants are going on. So surgery की demand तो बढ़ेगी, आगे भी बढ़ेगी, higher surgeries आएंगी. पहले डेंटिस्ट सिर्फ बोन के अंदर काम कर रहा था, अब वो बोन काट भी रहा है. अब वो बोन कम है, बोन कम आ रही है, तो वो जाइगोमा में भी इम्प्लांट डाल रहा है. People have found avenues to place implant. Okay, that is where the role comes of oral surgeon. Then oral surgery has got a role in cancer, onco. India is the world capital for oral cancers. So oral cancers के साथ तो ये आएगा ही आएगा, oral surgeons, right? Then oral surgery has a lot of scope in clefts. You can go in clefts, you can go in microvascular surgery, you can go anywhere and everywhere. One problem I'll tell you with oral surgery is, if you have plans to go abroad by chance, then don't take oral surgery now. Go abroad means settling abroad. For settling in developed countries, oral surgery need to have a MBBS background. That is a challenge. Okay, but in India, you can do wonders. Like there is a robotic surgery concept. Search for this guy, Dr. Som Dipto Das. He was my student in 2009, ranked 12. That time did KGM's BDS from Manipal, KGMU say MDS, oral surgery. Then he did 2 years of SRship in KGMC. Okay, he's in my friend list. You can search very easily. Dr. Somya, I'll take this here. Uh, 2 years back, first batch of MIT Boston passed out, expertise in robotic surgery, consisting of only 10 maxillofacial surgeons in India, and he is one of those. Okay, so sky is the limit. If you now, he's settled abroad only. Similar guy like you all, who got studying from Manipal Dental College, then getting into All India Dental Entrance, got 12th rank, then KGMC. अब if you take statistics, हर साल कितने MDS निकलते हैं oral surgery में, every year, like from government and private, but 1 or 2 people end up touching that. How he touched that is a long journey. During the 3 years of MDS, he was doing a lot of work. He was exploring the venues. He got to know about this. He enrolled in the SRship. He kept on writing papers related to that. He kept on doing work in relation to robotic surgery, and then he applied for a fellowship there. He got a full-term scholarship and he was invited there. It's your work catalog, it's your curriculum vitae, it's your biodata which speaks about you during and after MDS. for such opportunities in life. आप क्या बोलते हो दुनिया को, मैंने ये काम किया है, वो काम किया है, nobody trusts you. But if you have actually done your work, your documentation will help you. So when you are doing MDS, you need to document, you need to publish, you need to do such things. Okay, that's where you will be get acknowledged and then invited for such programs in life, right? Dr. Soumya, a lot of people say girls should not do oral surgery. See, it is a two-edged sword talking on this topic. It's not easy. Okay, male female ratio in in surgical world is as such less. The problem is they give you examples of more in relation to networking. Initial days of oral surgery, see, if you don't have a hospital based background, if you don't have people to basically support you by inviting you for surgeries in the initial days, you will lose interest, you will go depression. Okay, and the Indian society, rather the entire world society, has a male bias on the surgical part. It's not me who is like, and these are not my words, this is the what the world is already doing it. Okay, they feel males are more approachable at odd hours when it comes to calling for trauma cases. रात को 2 बजे एक road traffic accident case आएगा, तो पहले किसको call? If a hospital has two oral surgeons on panel, a girl and a boy, definitely they'll prefer calling a boy, if even if both of them are married or unmarried, because they feel it's easier to call a guy at 2 o'clock in the midnight. Okay, that is something which give prevents you. But yet again, if you are a girl and you are taking up oral surgery by choice, you do a lot of hard work in oral surgery, you do extra out of the box work in oral surgery, your thinking is unstoppable, you are unstoppable, then this bias will be lost, like, okay, then this biases doesn't exist. Such biases will is something like, I don't want to say it much, but it's something like, you can say resistance to some extent. Okay, like if somebody tells you AIMS MDS has only said 18 seats this time, right? There are very less seats, I will not give the exam, then it's your problem. Okay, but there are 18 students who will get those 18 seats. It's something like that. It's difficult in your case being a girl into oral surgery, but if you are amongst those top people, if you are doing extraordinary work, then you are unstoppable, then nobody can stop you, whether you are girl or boy or any sort. Okay, ortho, OS and ortho are very different in terms of speciality, because they are not at all part of BDS curriculum, and they are always in demand, and they are always going to remain evergreen. See, try analyze a difference when you do your MDS and you walk out into the real world. See, the MDS, the sorry, I'll go back little in time. What the BDS is telling you, the exposure we get as a BDS, especially in clinical branches, is very limited. Okay, what the real world is having is very different. Your exposure is very limited as a BDS, but the same branch, say perio in real world is very different. Ortho in real world is very different what we see in BDS level. Okay, so if you want to think it that way, like you did BDS, then out of that you selected a branch in MDS based on your experience, and then you enter the real world, you might feel a shock. Okay, it's going to be very different. Ortho and OS are some these two branches which are least taught at the BDS level. Okay, so when you enter into the real world, your actually the competition is very less. If an endodontist, I'll portray it with an example of endo. When an endodontist passes out, He says I am having expertise in RCT. Then there is a clinic nearby you who is run by a BDS who is doing RCTs more than you in last 5 years or 10 years. So maybe he has more experience in RCT than an endodontist. But yes, the approach of doing RCT will vary. I'm not saying it's going to be better all the time, but it's going to be different. It can be better, it can be worst also. Okay, it can be bad also. So that is where the competition starts. But there is no competition for ortho and OS in the market. You have to deal with your own competitors. Like ortho का competition ortho के साथ है, OS का competition OS के साथ है. Okay, that is what the basic point you have to understand. That is why these two branches enjoy little luxury in terms of easy and faster acceptance in the market as consultants. But yes, OS is a tough time. You need to give time for every branch to settle down. We have discussed 3 years of MDS, 7 years of 5 to 7 years minimum भी लोगे तो 5 साल आपको उस ब्रांच में काम करना पड़ेगा to gain that expertise level and start doing something else related to that field. Examples: Dr. Neeraj Roheda. He was my junior in college. Okay, all when I was ranked 135, he was ranked 22. I still remember. He was state rank 1 that time. Okay. नॉर्मल जीडीसी से जीडीसी मुंबई से बीडीएस किया, जीडीसी से एमडीएस किया, लाइक एनी अदर एंड मेनी अदर एमडीएस. हर साल ऑर्थोडोंटिस्ट पास आउट होते हैं. ओके, ही इज एन इंटेलिजेंट चैप. Okay, he is intelligent, he is smart, he was moving with the trends. Few years back he made a software called DTS, digital simulation software. Okay, digital smile designing software, something like that. You know, his software is now, he worked with a team with IIT. Okay, people, he must have some friends or something, or he approached them. He developed a software where you can show your patients how your pre-ortho post-ortho treatment looks like, how the smile designing can be done, planning can be done, and everything. Now his software is well number one software in India, and his software is sold across the globe now in European countries as well. People have started taking franchise of his software and selling across the globe. That is where you make a difference, and he is so called just an orthodontist. अगर इस आदमी ने भी आपकी तरह उस टाइम पे ये सोचा होता कि ऑर्थो का स्कोप क्या है, ऑर्थो का स्कोप है या नहीं है, कितने पेशेंट्स मिलेंगे मुझे पर डे, he would have never grown to that level. And yes, he is in top 20% of the pyramid. Start thinking on these lines. Start working in the direction of becoming what? Rich, famous, and successful. Don't have a narrow approach of मैंने ये ब्रांच ली तो मुझे कितने पेशेंट्स मिलेंगे, कितनी कंसल्टेशंस मिलेंगी, कितनी जॉब मिलेगी या नहीं मिलेगी, कॉलेज की नौकरी मिलेगी ना मिलेगी. That is the worst thing. Okay, you can do it to yourself by joining a private college. I'm sorry, joining at 30, 40, 50,000 a month, you have more value. I was like I have rejected, people are running about PSC jobs. I was selected in Haryana PSC and I have refused it. Okay, उस टाइम पे because it was very lucrative, 50,000 40-50,000 मिल रहे थे 2005 में, 5-6 में, I don't remember now, 6 में ही होगा. Okay, I thought my value is more than these 50,000. Seriously, it's like settling for less in your life. I have a friend, we two used to go to give the exam. We gave exam together in Panchkula, Chandigarh ke paas. We stayed in the same hotel. We went for the counseling. Tribune mein result aata tha. We went for that interview together. He joined it, I left it. Okay. And today he is Pulse Polio Abhiyan ka Adhyaksh and Swachh Bharat Abhiyan ka Adhyaksh of a small district in Haryana. His salary might be in 1.5 lakhs, maybe 2 lakhs per month. Over a period of time, definitely it increases. Okay, but in last 15 years he hasn't seen a dental patient. Maybe he loves that. That is why he's settled there. I didn't love that. That is what I started with. If you choose your job, if you love your job, choose your job that you love. You don't have to work and in a pressure rest of your life. Okay. So work in this direction. Don't think ऑर्थो करेंगे तो जॉब मिलेगी या नहीं मिलेगी, पेशेंट मिलेंगे या नहीं मिलेंगे, कितने पेशेंट मिलेंगे. डॉक्टर अमन, he was my student in Target Educare. He was rank 1 in Karnataka CET. When he came after passing out, okay, when he came, Dr. Aman Sachdev, ortho, the guy who taught you, I always tell I consider him as genius. Like, see, I have come across many BDS and MDS in my life, including myself and my wife. I can tell you, in dentistry and overall, he is one of the genius guy, a guy who has like IQ level very high. I treat uh, even I say like Jasmine ka IQ level is very high. Okay, Aman ka IQ level is in the range of say definitely if he goes for some testing, Mensa करके एक group होता है वो Mensa के लायक है. Maybe he is above that. Okay, when he came passed out like he did from GDC Bangalore, BDS from Manipal, MDS rank 1 in Karnataka, and he was MDS from GDC Bangalore. When the guy came out, he was very underconfident. कोई जॉब नहीं है, कोई पैसे नहीं है, सबके साथ ये होगा. I started my first job at 3,000 per month. Okay, 100 rupees per day. Dentist used to cut the money the day I used to be late, half an hour or 1 hour late. 100 रुपए काट लेता था वो. Okay, that is what your life starts how, and I don't blame him. I got to have a lot of experience based on that job. Next job was 4,000 and usi mein increment okay 4.5. This was my upper limit of a job before I started my own clinic. Highest I worked in 7 different clinics and 4.5 was the highest. And ये dentist 150 रुपए काटता था per day. Okay, ऐसे ही होता है. Then अमन का crying. I asked him, by chance, my orthodontist was leaving for US that time, Dr. Aval, and he was teaching also. I asked Aman, पढ़ाएगा हमारी academy में? And you, since you are rank 1 and I know you are a topper type student, उसने कहा हाँ सर पढ़ा लूँगा. We took a demo class and till date he is teaching more than a decade now, almost a decade. Okay, I invited him to my clinic also. Then started thoda sa. I still remember when he took his first class, we used to give check those days. आजकल तो ऑनलाइन ट्रांसफर होते हैं पैसे. सैटरडे संडे क्लास होती है, संडे आफ्टरनून को we used to give the check. Okay, this is your payout. Next week he came again to the center with a मिठाई का डब्बा कि सर ये मेरी जिंदगी की पहली कमाई है, ये उसकी आपको गुरु दक्षिणा है. एंड दैट इज हाउ एवरीबडी स्टार्ट्स इन लाइफ. अगर उसने भी यही सोचा होता ना ऑर्थो लेने से पहले कि मेरा पैसे आएंगे नहीं आएंगे, काम कितना मिलेगा, लेक्चर मिलेगा नहीं मिलेगा, पेशेंट्स मिलेंगे नहीं मिलेंगे, he would have never been successful in life. Okay, today he doesn't have time. I have to take his dates at least 10, 20, 30 days in advance for a lecture. ये अगर मुझे क्लिनिक पे भी बुलाना ना, इतना बिजी शेड्यूल है. ही इज वर्किंग इवन ऑन संडेज. ही इज नाउ स्टार्टेड लास्ट 3 months back or 4 months back he started keeping Monday off for his family now. He has a young kid, 1.5 साल 2 साल का. Okay, that is where the life will give you opportunities, but you keep on growing. That's how you become successful. Okay, then public health, OMR, OP. Yes, there are no jobs in colleges, but dentistry was not about doing a job in a college. जब आपने 11th स्टैंडर्ड में बायो लिया था, अपने दिल पे हाथ रख के बताओ, यू वांटेड टू बिकम अ डॉक्टर और यू वांटेड टू बिकम अ टीचर? आंसर मी. ग्रेट, सबका यही था। ठीक है, किसी की रैंक आगे थी, किसी की पीछे थी, किसी ने चॉइस से डेंटिस्ट्री ली, किसी ने गलती से डेंटिस्ट्री ली बिकॉज एमबीबीएस नहीं मिल रही थी, सो वी ऑल एंडेड अप डूइंग बीडीएस। ओके, नाउ यू आर एंटरिंग इनटू अ बिगर लाइफ. Okay, see, your journey of life will have stages. Stage 1 is your end degree. You can end up remaining BDS rest of your life, or you can end up remaining MDS rest of your life. Stage 1. Stage 1 is basically learning, nothing else. Nothing else. Stage 2 starts after your end degree. Say you have done your MDS, now the stage 2 starts. Stage 2 is all about gaining expertise. Whatever you have learned in those 5 plus 1 plus 3 years, you have to gain expertise in that. Stage 3 is now experimenting with your field. You can go into research, you can innovate, you can educate, you can do wonders after that. Okay, so job तो कभी एजेंडा ही नहीं था डॉक्टर का. Like, you never want to become a teacher by entering a college. I know people like Varun Pruthi. See, they are very close. We are families now for many years. That is why when I left, it's not what I left. When we all decided to leave Bhatia, we all left together because our ideologies doesn't match with DVMCI at all. Okay, Varun Pruthi, Aman Sachdev, these people never worked in colleges. स्ट्रगल इन्होंने भी किया है. मैंने आपको बताया, अमन का मिठाई का डब्बा लेके आया था वो फर्स्ट जॉब के बाद, फर्स्ट पे चेक के बाद. ध्रुव अरोड़ा सर ने जॉब किया है आईडीएसटी डेंटल कॉलेज, बट उनके जॉब ऐसे होता था 30 में से 10 दिन जाता था, 10 दिन 20 दिन नहीं जाता था, 15 दिन मैक्सिमम ही यूज्ड टू गो वाज हैज गॉन वाज 18 डेज इफ आई एम नॉट मिस्टेकन. वो स्टिल ही लाव्स व्हेन वी सिट टुगेदर. मैंने आज तक एक पूरा सैलरी चेक नहीं लिया किसी कॉलेज से. ओके, वो कॉलेज नहीं जाता था तो वो कहीं क्लिनिक पे काम करता था. देयर इज अ वे बिग लाइफ वेटिंग फॉर यू outside those colleges. But yes, if you want to become HOD, principal someday of some college, then yes, you need to enter that channel. See, that is one option, but don't make that as a closed end for your life कि अगर जॉब नहीं मिला तो कुछ नहीं कर पाएंगे लाइफ में. ऐसा कुछ नहीं है. These branches too have lot of scope. PhD is now semi-clinical, so you can always enter into full clinical, or you can, after COVID, statistics is in huge demand, public health is in huge demand. Enter on those channels. Dr. Manish sir's wife is also public health. I'm just giving you an example. Manish sir and उनकी wife ने एक WHO को प्रोजेक्ट प्रपोज किया था पोस्ट कोविड केरीज एंड डेंटल हेल्थ प्रॉब्लम्स इन इंडिया का एक स्टडी है. Around 100 of public health dentists in India had applied for that opportunity to work with WHO, and Manish sir and his wife has got that project signed from WHO now. They have got grants, huge grants also, conducting that survey project in India on behalf of WHO. You need to be the best in the field, knowledgeable, networked person, experienced person to come to this level at this stage of life. Okay, OMR. The world is moving into technology, teleradiology, CT scan. If you are a person who loves technology, enter into OMR and go into the field of radiology. Don't go into somebody who just diagnoses lichen planus and treats it and becomes happy. That's what everybody in OMR doing it. I know people in OMR who are doing great practice by excelling into other procedures as well, because India is not stopping you to practice only OMR like US. OP, again, jobs are not there, but India is cancer capital. You can be a person who can become cancer specialist to know what level you can go. My friend Dr. Gaurav Sapra, he is professor in IDS Bareilly. पूरे यूपी में अगर ओरल कैंसर की कोई रिपोर्ट बनती है तो डॉक्टर गौरव सप्रा के पास क्रॉस वेरीफाई कराने के लिए भेजी जाती है. चाहे वो मिनिस्ट्री से हो, चाहे वो कहीं से भी हो, because he has become authority in diagnosing and claiming yes this slide is belonging to a cancer patient. डॉक्टर भुवन नागपाल, एक इंटरव्यू हमने डाला भी था पहले. ही वॉज माई स्टूडेंट फ्रॉम मानव रचना डेंटल कॉलेज. इसको हम पूछ, टॉपर था ये फर्स्ट बैच का मानव रचना का. एंड वी यूज टू आस्क हिम, अगर तेरी टॉप रैंक आएगी तो क्या करेगा. ही यूज टू से रैंक 1 भी आएगी तो भी मैं ओपैथ लूंगा, बिकॉज दैट वॉज हिज लव फॉर द सब्जेक्ट. ओके, एंड ही डिड ओपैथ. Then he chased DCI, what is the spectrum of OPATH. And then he realized and he told the world that oral pathologists can also work like a pathologist with pathological labs. Today he owns 2 pathological labs and he is CEO of one biggest chain of pathology labs in Haryana. Okay, so scope की बात नहीं है. Again repeating the same thing, branch does not have a scope. Branch does not have a scope. It's you who has to develop scope for the branch. It's you who has to develop scope for the branch. So if we conclusively one session on this, like one more session on how to choose colleges, we will do tomorrow. Okay, uh, tomorrow is Wednesday. Yeah, tomorrow only we will do. When you complete your BDS and then your MDS, you have equal chances of entering into this. You can start moving towards top of the pyramid, you can end up in the middle of the pyramid, and you can remain at the base of the pyramid. It's your choice. Okay, it's how much you do, what you do in MDS will matter more, not the branch. Any and every branch person will enter top also, below also, and middle also. Okay, what you do in MDS, how well you do in MDS, how well you make yourself ready for the real world counts more than anything else. Okay, that's all for today. You can ask your queries. Videos in your channel. ये वीडियो तो रहेगा ना, like this is a live session, it will remain in the video, it will remain in the YouTube channel only. Now any queries, any questions, will answer related to MDS specialty, how to choose it. Okay, college wala will do tomorrow. How to choose a college, we are going to do it tomorrow. No questions? Chalo, no questions, so it's best. That will save everyone's time, I believe. Hope you liked today's session. You got a different perspective, you got something different than what you have been thinking in relation to any branch or specialty. Cosmetic surgery, see, there are little domains, you need to work in that domains. Cosmetic surgery means rhinoplasty and all. Search for this guy, Dr. Rohit Punga. He is our team member only. MDS, OMFS, what they call. Search for this guy. This guy is like my parallel batchmate only, very close friend. He is HOD of Sharda Dental College as on today. Okay, and he is doing great in rhinoplasty. People in South are doing rhinoplasties and all, chip augmentation, cosmetic surgeries, many things. He has done even a small procedure in MS Dhoni also. Okay, because he didn't restrict himself after doing OS. He did from AB Shetty. He was 7th ranker in Comed K, some ranker in KSET also, and he was getting a government seat. He left for AB Shetty ka OS. This guy didn't limit himself to extractions, impactions. You won't believe after 10 years of oral surgery, he started doing implants. Because those 10 years, he explored into multiple areas. He did fellowship in microvascular surgery, he did small fellowship in cleft, he did it in cancer also. Then he realized that facial surgeries and all are his forte area, and handling pan facial trauma. आज भी Fortis Artemis Hospital in Gurgaon, when they are stuck in pan facial fracture trauma case, they call him out of the blue. Recently also the case was there, 4 hours की surgery के बाद they were not able to reduce some part of fracture, so they called him, and then another 6 to 8 hours he worked, and that is his expertise. Okay. Dr. Amruta, it's about the same thing. It's not about PG, doing a PG or not doing a PG. It's about exploring that avenue and growing. Keep on, if you're doing a PG after a long gap, forget about that gap first. Take it as your starting point today. I told you when your stage one is when your last degree is completed. First, complete your last degree, but don't just have MDS degree namesake, like just for the having sake of having MDS. In those 3 years, explore maximally जितना कर सकते हो within your limits, and then work in that field to grow more in life. Okay, since you have spent 3 years in that field, you should spend another 3 to 5 years doing a lot of work in respect to your branch. Then only you will gain expertise into that. Chalo, thank you. We'll see you tomorrow. I'll post poster in your YouTube community also, and in the group also, how to select a college in MDS counseling. Okay, thank you. Have a great day. If I decide to take ortho, how do I know that I'll be good in it? See, पूरे सेशन के बाद ना कोई भी ब्रांच आप ले लो, हार्डली मैटर्स. Okay, except for OS, I would say hardly matters. You take any branch. You take any branch, but after taking that branch, don't script for another thing. First thing. Second is, after taking any specialty, start developing interest, reading more and more, seeing more and more work, and doing more and more work. That's how you fall in love with any subject. ओके. अब आपको पता है 3 साल यू आर हैविंग ऑर्थो ओनली, ऑर्थो ही पढ़ना है तो पढ़ो ना. आफ्टर 3 years डोंट एंड अप इन अ सिचुएशन कि अरे मैंने वो नहीं पढ़ा, मैंने ये काम नहीं किया, मैंने वो नहीं किया. आपके पास 3 साल थे टू एक्सप्लोर इनफाइनाइट ऑप्शंस इन योर सब्जेक्ट. जर्नल्स क्या, बुक्स क्या, डेटा क्या, थीसिस क्या, व्हाटएवर. You should be master of the subject after 3 years rather than just again. If you had done this mistake in BDS कि बहुत चीजें नहीं पढ़ी हैं, don't repeat it in the MDS level. After MDS, make sure that you are authority in that subject. Then only the world will start respecting you, inviting you, and you will start moving slowly and gradually towards your becoming rich, famous, and successful. Okay. Chalo, thank you. And I told you, any query or something, you have the number 9350256286. WhatsApp first, then we'll discuss on call. Okay. Thank you. What should be our aims? I told you, just rewind the video. It's there. कि MDS में 10 points क्या करने हैं आपने. We have done that. Okay. चलो, thank you.